Thank you, Chairman Westerman, distinguished community members and attendees. Hello, I'm Mark Earl Rogers, CEO of the Osage Nation Health System. It's a distinct honor today to present before you on behalf of the Honorable Chief Kahika Jeffrey Standing Bearer of the Osage Nation some brief remarks regarding positive impacts of our health programs upon the Osage people, their families, and the community through the life-changing impacts of self-governance and self-determination in Oklahoma's largest county, Osage County, located in the Pawnee Service Unit. Our funding via a compact with the U.S. government under the self-governance mechanism has brought incredible economic viability, stability, and services to the people of the Osage Nation and other tribal members we service. Along with our grants programs, I often describe these integrated services as a programmatic tapestry or quilt of interwoven programs to service our population in ways that are vitally important to the health and well-being of the Osage Nation and does indeed have life and death consequences for many of the people we serve. Some of the services include medical, dental, optometry services, specialty care, behavioral health and substance abuse services, and other vital programs like public health immunization needs of the community. A diabetic grant providing education, limb care, and control of diabetes to decrease noncompliance, lowering long-term diabetic complications such as dialysis and limb amputations. Osage Strong is our active early interventional program we have in our clinic educating children and adults on healthy eating, dieting, and exercise with weight management for all overall health. Serving nutritional meals and addressing food insecurity annually for our tribal members via Title VI program, and community health representatives and senior services grants within our health system provide for the transportation of elders to medical appointments, sometimes a 4 to 5 hour round trip into and out of Osage County, as well as provide social services, case management, and other coordinated care for a population often suffering from geographic loneliness, food and transportation insecurity whilst residing in these remote parts of our area. Mobile Medical Unit Program, we have 2 units in operation that service the medical, dental, behavioral, and public health vaccination immunization needs of our tribal members located in areas where reliable transportation is a barrier to accessing health care and are reliable, often supporting non-tribal members in the process. Noteworthy of this program is when the Osage Nation had a tribal response to the 2024 Barnstorm tornado emergencies during multiple declared federal, state, and tribal national states of emergency. Self-governance provided not only more services to the tribe in the area, but it has also generated incredible economic opportunities for both Native American and non-Native citizens alike. Everyone prospers in the community when the Osage Nation prospers. Self-governance has provided this ability to deliver these programs and services to the people in a more robust, decentralized manner, allowing for the Osage Nation to leverage these vital programs and services as a result. Some of these opportunities include approximately $85 million in new construction with investments in health-related services with a new clinic, expansion clinic, assisted living facility, primary residential substance abuse center providing jobs and opportunities on a grand scale in the community. Our self-governed tribal health system and grants create jobs via annual budget of $62 million in the region with payroll, taxes, community infrastructure, education, and housing market stability. It also provides valuable cultural and tribally unique opportunities for the Osage people that are vitally important as a proud, viable nation of Native peoples central to self-governance and self-determination. Our area vocational programs and higher education institutions also benefit with producing the future workforce necessary for our programs and deliver these vital services to the community, keeping the next generation home with the future and thus bending the curve of outward migration from decades past. Development of the Deposhka and the Dabi Osage Art School to strengthen and preserve the language and culture through education is important. The economic impacts of being a self-governed tribe for a new younger generation to remain within their communities that had not been previously available. Osage Nation tribal members are also more involved in their governance, providing more employment opportunities in tribal government and with other elected positions in their tribe now and into the future. The ability to remain culturally active as a tribal nation and to grow and stabilize in ceremonies, language, and traditions, all vitally important to the Osage people since time immemorial, with traditions handed down from their ancestors allowing for the Osage people to be the Osage Nation. It's with great honor that I share my experience with you on behalf of the great Osage Nation, its proud people, and to present this testimony today before this committee as requested. Thank you again for this opportunity, and thank you, United States Congress, for all it has done and continues to do in advancing the recognition, economic needs, and self-determination of all Native peoples. Thank you.